Hello, this is Miguel Gomez with AIDS.gov. I'm here with Mr. Jeff Crowley at the U.S. Conference on AIDS in Chicago, Illinois. Sir, you did the opening plenary. What were your key messages coming out of the plenary, your presentation, sir?
So the key messages from my remarks yesterday was really, first I acknowledged that I'm leaving my position at the Office of National AIDS Policy at the end of this year. And I really wanted to thank the HIV community for all their support. You know, I've been humbled and privileged to serve as President Obama's HIV policy advisor. And I've done nothing alone, but I think we've done some really important work together to develop and begin to implement the National HIV/AIDS strategy. But as I thought about where we've come so far, I tried to give some recommendations or reflections on what I think the HIV community needs to focus on going forward. So, you know, I really tried to say, let's set the federal government aside. They need to do their job, and I think the administration is really stepping up and demonstrating a whole lot of leadership and energy. But really I wanted to reflect on what I think the HIV community needs to do, and I had sort of three messages. I asked them to ensure that even though there's fault lines in our communities, there's tensions among groups, we have to stay united. We're at our best, and in these tough times we must keep working on a common vision and not fight amongst ourselves. The second point I made is that we really need to make sure that we're taking the steps now to keep our community-based organizations strong and relevant in the future. We know that the economic downturn is creating pressure on organizations. We know that the Affordable Care Act is going to greatly expand access to insurance coverage for people with HIV, but it's also going to change our health system, and that change is frightening to a lot of groups. But, you know, we've dealt with tough times before, and our community needs to come together and take the steps to make sure that these organizations are here for the long term. And then the third thing that I think we need to do is, you know, we've all reflected on this exciting research we've had in the last year and a half or so. What do we do to make sure that those aren't research studies that exist in, you know, the research realm and really make it relevant into U.S. communities? So the question is, how are we changing the programs we operate in American communities to make sure we ensure that all people can benefit from treatment like that?
One of the things that's really important, which you also addressed, is it's tough economic times. What advice do you have to the HIV service community in the United States during these times?
Well, you know, when we developed the strategy, it wasn't really a budget document. What we said is it was identifying the priorities for the nation and would help us make a case for more resources. Our community can't just assume that money will come its way, and I think we need to make a case to, whether it's legislators or the American people, the benefits of the public investments we're making. You know, we'll invest more than $20 billion just in responding to the domestic HIV epidemic this year. That's a sign of generosity from the American people, and those investments are paying off.
Why, thank you. This week, we had, of course, Secretary Sebelius speaking along with you at the U.S. Conference on AIDS, but we also had Secretary Clinton speak at the National Institutes of Health and call for government policy supporting an AIDS-free generation. Could you elaborate on how important that is for our U.S. audience?
Certainly. So Secretary Clinton gave a major speech at the National Institutes of Health, which was a very forward-looking perspective on what is possible now because of this great research. We know now how we can end the AIDS epidemic or pandemic around the world. It's going to take a lot of work. As she said, it's not on the horizon. But she laid out a bold vision for how we get there by scaling up access to effective prevention services, really integrating treatment so we both are helping people stay alive and protecting their health, but also lowering the transmission risk. So in these tough times, as people are asking basic questions about what our government can afford to do, just like making the case was important. But, you know, for Americans, that has to be our vision for what can happen in the United States as well, and I think it's consistent with the vision for the National HIV/AIDS strategy. Is we now have the tools to imagine a generation that's free from HIV and AIDS.
Why, thank you. And looking forward, next year in Washington, D.C. will be the International AIDS Conference, AIDS 2012. Do you have any suggestions or observations about that conference, sir?
Certainly. So this conference is coming back to the United States for the first time in more than 20 years. It was made possible because President Obama eliminated what's called the HIV entry ban, and the conference was consciously not held in the United States. They boycotted us because of this policy. Now, this was a policy change started by President Bush that President Obama completed. It made it possible for the conference to come, and we're excited to host this conference. I think it's particularly important to be in Washington, D.C. So much great U.S. research has really created a lot of opportunities, and so it's really exciting to bring the global community to the United States, but it's particularly important for U.S. People that work on HIV because, let's face it, it's expensive to travel overseas. a small number of people get this opportunity when it involves international travel. We think it'll be an exciting opportunity for Americans that are working so hard to fight HIV in our communities to engage with and learn from people from other countries. And just the rich dialogue that we think will happen, I think is very exciting, but also will, I think, propel our collective efforts forward.
Well, thank you, sir. And we again want to thank you for your service. This is Miguel Gomez with AIDS.gov. Thank you.